Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to perform a dental on a canine for fall semester veterinary nursing care 2024. Okay, so for our hand scaling portion, I'm going to go over the instruments. So these are your curettes. This one is your working universal curette. This can be used on, it can be used to remove calculus above and below the gum line, anterior and posterior teeth, and buccal and lingual surfaces. So you're going to adapt the curvature of the curette to the tooth, and in a pulling motion, you will pull towards you. You don't want to use your wrist because that's bad ergonomics. So pulling towards you. The other thing is too, if you need to, you can insert this below the gum line towards that pocket, and then very carefully, and then pull towards you. And then this is your working Barnhart curette. This is ideal for larger dogs. This can only be used on the posterior teeth, above or below the gum line for the same purposes, and it's used the same. So you'll on the buccal and lingual side of the posterior teeth. So you'll pull it towards you, adapt the curvature to the tooth, and in a pulling motion, remove that calculus. Next we have our scalers, our working scalers. So this first one is a very flat surface. It's ideal for the anterior, so the front of the teeth, and in about a 70 to 80 degree angle, you will place it above the gum line. This is not meant to go below the gum line, and you will pull towards you. So it's going to move all of the calculus that's on the front side of the teeth. Then we have got our working scaler. So it looks like this. Those are very sharp, not meant to go below the gum line because they will lacerate. So this is used on the back of the teeth, and at a 70 to 80 degree angle, you'll adapt it into these grooves and you will pull. So that is what that's meant to do. It's also great for removing stains. And then lastly, we have our Morse scaler. So there's that. This is great for, again, removing stains. It's good for your canine teeth, so 104, 204, 304, 404, and your premolars, so the fourth premolars, so that's the 108. Again, at that 90 degree angle, you'll place it onto the tooth surface above the gum line, used for overcrowded or overlapping teeth, so especially those molars and premolars. So yeah, this goes into the grooves of the tooth that those other two scalers don't go into. Then we have our Shepherd's Hook Explorer. So this is used to detect those gingival pockets. You can use it throughout the mouth. You'll place it below the gum line, and you will very gently, it's kind of better for exposed roots, so you'll very gently move it around. You can use it on all aspects of the mouth, but this is really great for those multi-rooted teeth, so furcation, to detect pockets in those types of teeth. And then we have our universal probe that's 18 millimeters, so that you will place below the gum line, and you will take your measurement and you'll work it slowly around the tooth 6 times to get those readings and record them. So this is again going to look for your gingival pockets, use fading involved. This is how you're going to detect those. And then lastly, you have your mirror. This is so that you can see portions of the mouth that you are not able to normally see. It helps illuminate those, better visualization, and you can also use it as a cheek retractor. So it's great for that. They do make some that can be different sizes depending on the size of the dog or cat, larger for larger animals, smaller for smaller. So that is our hand instruments for hand scaling teeth. All right, so we're going to be shooting for 108, 109, and 110, which is the right fourth molar, third, and second molar. And you want your cone to be 45 to 55 degree angle, and your sensor aligned up pretty straight with the teeth there and the outer edge of the sensor. So beautiful. So now now we're going to be doing 105, 106, and 107, which is the right upper first molar and then third and second premolar. One's going to be at about a 45-degree angle, shooting at the roots of where the premolars would be, and then our sensor is lined up along the edge of the teeth with the sensors inside the mouth. So now we're going to be doing 104, which is the right upper canine. So you want the cone high above the muzzle, angled towards that canine, and then the sensor here, you've got the canine tooth pretty center on it, and then most of that sensor on the palate. So. Okay, we're adjusting to make the cone a little taller of an angle to get more of that root. Awesome. Go. All right, so we're gonna do 103 to 203, which is our right upper incisors and then our left upper incisors. And so then with the cone, you want it angled towards at about a 45 to 55-degree angle, angled towards the crown. And the same thing with the sensor, you want it flat in the mouth, facing towards those crowns there. So.
I come a little over to the right. Yep. I think.
Yep, right. Yep. Cool. All right, so we're now on to 204, which is the left upper canine. Our sensor, again, is going to be sitting pretty flat with the canine tooth, most of that in the palate, and then our cone angle is going to be 60 to 70 degrees, high up over the canine. So. Go. All right, so now we're going to do 205 to 207, which is the left upper premolars 1, 2, and 3. Our cone angle here is going to be about 50 degrees, and our sensor is going to be placed flat into the mouth with the edge of our teeth lined up with the edge of the sensor. Okay, so we're going to be doing 208 through 210, which is our left upper molars 1 through 4. So our cone is going to be at about a 45 to 55-degree angle, pointed caudally, and then our sensor is going to align with those teeth towards the back of the mouth there and flush with the crown. So, and you want some of that on the edge. All right, so now we are onto our mandible. We're doing 409 through 411, which is our 1, 2, and 3 molars on the lower right side. So you want your cone perpendicular to the sensor, and the sensor you want lined up between the tongue and those teeth. So. Okay, so now we are going to do our 405 through 408, which is our left lower premolars 1, 2, and 3. So the sensor should be placed deeper in between the mandible and the tongue, as opposed to those molar views, so that you can get the apex of the tooth. And then your cone is going to be at a 45-degree angle to that sensor. Yep. All right, so now we are on to 405 and 406. You want your cone to be perpendicular with the jaw, and then your sensor should be, it can be between the mandible and the tongue, and you also want most of that plate inside the mouth. So that is going to be your right lower first and second premolar.
And then the breath, you need to see the chest rise. Same thing with us.
So now we're going to shoot 404, which is the left lower canine. You want your cone to be at a 60 to 70 degree angle. You want the 90 mark to be pointing towards that 406 premolar. And then same thing with your sensor. You want that crown aligned with the 405 and 406.
Beats per minute, your heart rate and stuff like that.
So now we're going to do 403 through 303, which is our lower incisors. You want the cone to be high above the or midline of the mandible, and then your sensor should be pretty flush with those crowns. Go. Okay, now we are on to 304, which is the left lower canine. Again, you want your cone to be about 90 degrees over 306, which is that first premolar, and your sensor should be lined up on 306 and 305.
That one did show up. It said Pharaohs that show up.
Oh, never mind. You guys look here.
So for 305 and 306, we want the cone to be perpendicular to the jaw, and then you want your sensor that can be between the tongue and the mandible, but you want that in the mouth with the DT lined up with the sensor. Go for it. So we were actually able to get 305 through 308, so that is our first, second, and third lower left premolar. Okay, so now we are going to do 309 through 311, which is our left lower molars 1, 2, and 3. So your cone is going to be perpendicular to your sensor. You should see part of your sensor because you want it higher above the tooth to get all of them in. Okay, so we're making some adjustments because this patient does not have 311, but we need to show that.
How's it look, Jackie?
Looks good. Just we have, smoothing.
There we go. Okay, so using my scaler, I am going to place it up to the gum line and pull. Alright, so now I'm going to use my curette. This can go below the gum line, but I'm going to use the modified pen grasp again and pull towards me. And then if I wanted to, I got most of that out. I could use my Morse scaler and go into the grooves to clean those out. Careful to only keep contact time to maximum of 10 seconds per tooth. Otherwise, you can overheat the pulp and cause permanent damage or death of that tooth. All right, so now I'm going to polish those teeth. Doing small circular motions, making sure those edges flare. Okay, so I want to share some products with you after Fluffy's Dental today. We do recommend brushing, starting off with once a day. You want to use our enzymatic toothpaste. Human products can have additives that are unsafe for dogs. And a soft bristle brush. So it's got a small side and a large side for cats, small dogs, large dogs. And what you're going to want to do is starting with only a few teeth since they're not used to it. Brush a couple teeth the first day, get along that gum line in a circular motion, and then keep adding in a few teeth every day. So this is something, if you can start off by doing it slowly and work yourself up to twice a day with a full mouth, it's good for them just like it is for us. But starting off with those few teeth and getting them used to it. Next, we have a water additive. This is just meant to help strengthen the teeth, prevent calculus buildup so fast. It is based off cat or dog body weight. So since Fluffy is 25 pounds, he would get 5 mLs of this, which I believe is 1 tablespoon once a day. You will have to change the water out daily with this, but it can help with that fresh breath and the delay of calculus buildup. Okay. We have 2 different treats here. So these are dental chews specifically. They are meant to help break off the tartar and keep those teeth healthy. So when you give them these, it should be once a day, unless the vet tells you more often or less often. You want to make sure that they're chewing them well though, not just taking a big bite and then swallowing, because the key to getting all of that calculus off and preventing it is to make sure that it's scraping against the tooth surface. So once a day, if they are eating them pretty quickly, you can always hold the treat for them and let them, then you have discretion as to how fast or slow that they go. And then we do offer a prescription diet called TD by Hills, and that is a food that is meant to be harder to help break off the calculus and prevent buildup at a slower pace. Okay.